Hey everybody, Pastor Matt here. I want to just talk to you a little bit about this coronavirus thing that's coming out. It's not just a little thing, it's actually fairly significant. We just now have two cases that's come here to Colorado. All of them are from out of town, but still, there are two cases that are here, and we want to make sure that we're doing all that we can, not only to be prepared, knowing a little bit about what it is, but really, I want to just focus on some things that you can be doing. When you come to church, it's a public place, and really, it's just it can be a convention for a lot of different germs. So that's why we have to be really careful, even when we're shaking hands, touching our face, doing all of these little quirky things that we may end up doing. We've got to be really careful about that, not just for the coronavirus, but for flu and other sicknesses that end up coming about. So below, I'm going to give you a great link on how you can, on what the coronavirus is all about, what you can do day to day to be able to help out and making sure that everything is good. But I don't necessarily want to go through all the particulars of the coronavirus, but it is a respiratory disease, and you've got to be very careful when it comes to your lungs. We know travel has been affected in going to other countries. Every continent has been affected by this, with the exception of Antarctica. And so we want to make sure that we are approaching this well, but not approaching this in a panic. The ERLC article says that Trusting in God equips us to take the threat seriously without giving in to panic or despair. We can grasp the gravity of the situation while knowing that nothing is beyond His reach. That's a good thing to do. What are some things that where are some places that you can go to look up and find out what the latest is? The World Health Organization. Look that up, as well as the Centers for Disease Control and Prevention. As the article says, they're not infallible, but boy, they can really help you. And there's some things that are there in a user-friendly format that can really help you be able to move forward. But when it comes to church, I mean, when you were hearing the hysteria and the panic, there were actually some questions about what would happen if something like this ended up hitting our churches. Like I said, sometimes churches and schools and all these things can be conventions for germs. So we've got to be proactive in making sure that we are doing all that we can. So one of the things is that you wash your hands frequently, up to 20 seconds. Say your ABCs. And make sure that you get everything scrub. Really be helpful with that. Be careful with that. Alcohol-based sanitizers are also effective in killing viruses. I have some right here. But there's also Germ-X, Purell. Be proactive about that. Observe good cough and sneeze etiquette. Cover your mouth and nose in the crook of your elbow or with a tissue that should be immediately thrown away. Some of us have a habit. Blow your nose, roll it up, stick it in your pocket. Blow your nose, discard that thing. Find a trash bin. Discard it. But make sure that you are not doing what you need, what you're not contributing to the spreading of these germs. Avoid close contact within about 3 feet. That's considered close contact with people who are sick. So stay back. And if you are sick, just please, unless you have to be out, please don't. Unless the Lord tarries, church will take place next week. When it comes to your kids, where it comes to you, please, just consider. Watch us on Facebook, and then when everybody's healthy, come on back. Beware of your risk of transmitting infection to others. Please stay home if you feel sick. I just said that, didn't I? Contact your medical provider and let them know you're ill and follow their advice. Sometimes a nurse will just tell you what you need to do, some over-the-counter stuff that you can go. But be proactive about that. Well, I don't want to be a hypochondriac. Well, be a hypochondriac. Just make sure that you're doing all that you can to stay healthy. If you're not sick, face masks are not helpful in preventing infection. If anything, masks cause people to touch their nose and mouth even more as they surreptitiously adjust them. On the other hand, if you're sick, a face mask can be useful in preventing the spread of disease by containing secretions. If you're sick, wear a face mask. If you're not sick, don't wear a face mask, because I know that's how I am. I hate things on my face, and so I'm always doing something. Well, what I'm doing is taking those germs and putting them right there for them to be able to be affected. Follow the advice of your local healthcare agencies. If they recommend temporarily avoiding public places or large gatherings, do your best to comply. Do your best to comply. And that's what we have to realize. We've got to take care of each other. And we've got to, this is part of loving our neighbor. Sometimes we think we're just so thinking about us, and we got to soldier on, and everything will be fine. But God has given us common sense to be able to look through these things and to care about other people when it comes to taking care of ourselves and make sure that we're not spreading germs to other people. So let me know what you think. But if anything ends up spreading even further, we'll be back on here to let you know what exactly this is about. But we'll make sure that we have this particular article there for you to be able to look at. Hey, take care, everybody. Hopefully I'll see you on Sunday, good and healthy. Bye-bye.